largest follow-up studies to date involving 25 pediatric hospitals, more than a quarter of children and adolescents hospitalized with coronavirus infection early in the pandemic still had health problems 2 to 4 months later, either persisting symptoms or activity impairment. The study, led by Boston Children's Hospital, is published August 12th in the journal Pediatrics. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman, and today I'm going to talk about children hospitalized with COVID-19 or MIS-C who have lingering complications. As part of the National Overcoming COVID-19 study, investigators led by Adrienne Randolph of Boston Children's surveyed family caregivers of patients under age 21 who were hospitalized with COVID-19 or multisystem inflammatory syndrome in children, acronym MIS-C. Of these children and youth, roughly 40% were hospitalized with acute COVID-19 and roughly 60% with MIS-C. 50% and 86% respectively were admitted to the intensive care unit. At 2 to 4 month follow-up, 27% of patients with acute COVID-19 and 30% of those with MIS-C had persistent symptoms, activity impairment, or both. Of the children and adolescents with lingering symptoms, the most common symptoms were fatigue or weakness, shortness of breath, cough, headache, muscle and body aches, fever. Activity impairment was somewhat more common after MIS-C than after acute COVID-19. 3 factors predicted an increased risk for a prolonged recovery or activity impairment, like more organ system involvement in patients with acute COVID-19, underlying respiratory conditions, usually asthma in patients with MIS-C, or obesity in patients with MIS-C. Now that vaccines are available, I strongly recommend that children and adolescents get vaccinated, said lead researcher Adrienne Randolph. We know that patients can be reinfected even if they have had COVID-19, and we previously showed that vaccination can prevent MIS-C and severe COVID-19, she added. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.